Welcome to a dialogue to do with gender-based violence, HIV/AIDS, and also matters related to reproductive and health rights. My name is Mubarak Mugabo. Now, there has been a global conversation on these issues. Different platforms, different international organizations, and different governments are doing a lot to make sure that they are building a community that is free from these criminal activities and also these segregations and discriminations that are going on in this world. Now, there is also a traditional and a conventional way and mindset where people think that our forces are mostly male dominant and they're supposed to be only responsive to the male gender in our society. We just want to have a conversation on how the Ministry of Defense and Veteran Affairs and the Uganda People's Defense Forces are getting involved in this conversation. Joining me to discuss this are 5 distinguished guests. First of all is Mr. Mike Wambi, is the Commissioner in charge of Resettlement, Psychosocial Support and Rehabilitation at the Ministry of Defense and Veteran Affairs. Secondly is Brigadier General Felix Kulaije, is the Defense Spokesperson. Third person is Captain Solomon Kandole, is the Deputy Director HIV/AIDS at the Ministry of Defense and Veteran Affairs. Fourth is Miss Hope Kabarungi. She is a Gender Officer at the Ministry. And last but not least is Mr. Samuel Mweru. He's the Principal Communication Officer at the Ministry. Gentlemen and lady, thank you so much for joining me to this discussion. Let me start with you, Commissioner. As I said earlier, there is a global conversation, and the world today is discussing better ways on of preventing and dealing with sexual gender-based violence. Tell us how the Uganda People's Defense Forces family and the ministry, and specifically both of the people that you're working under or working with in service and veterans, is perceiving this conversation.
Good morning, and thank you, moderator, for that question. First and foremost, I should say that the Ministry of Defense and Veteran Affairs, the UPDF, are not just perceiving this discussion. I've been a part and parcel of it. And if you look back into the history of this country, it was only under the NRA that we first had first female combatants, and all through that we've grown in the ranks, both women and men, and as a consequence of that, of course, recall that we all come from the general Ugandan society. So matters gender-based violence may not necessarily be ruled out in the context of our institution. And so we are very active in it in terms of policy, in terms of legislation, in terms of what we do, that we are all the time conscious about this, and it takes us to the realization that when we work together as men and women in a harmonious environment, then we can achieve a lot. And to that effect, we've derived all our actions from the gender policy of government that is in place. And building on that, of course, we have the UN Resolution 1325 that talks about issues of gender. So in partnership with the UN family, and in particular the UNFPA, we are doing a lot on these matters, and as we move on, I'll try to elaborate what we've been able to do and what we are yet to do.
Exactly. I will come back to you and you elaborate more on that partnership, but I want now to bring in Brigadier General Felix Kulaije. Why should our force and our forces attach great importance to such conversations of sex, marriage, family, instead of actually intensifying discussions on how you are defending the territorial boundaries of this country?
I'm sorry to laugh, because the stereotype thinking about the military is war. Once you see somebody in uniform, that's a combatant. Agreed. But all of us are combatants, including you. It just depends from what angle you are doing the combat duties. On matters of gender, you cannot talk about a revolutionary force like UPDF, and you're not talking about women emancipation. And you won't talk about women emancipation unless you are availing the female gender equal opportunities like the male gender in the military. However, for us who have gone a bit beyond, you find the female officers are fast-tracked in career progression compared to their male counterparts. And that positive discrimination is purely based on our devolutionary ethos that we must correct the mistakes of the past. We must give every Ugandan the opportunity to exploit their talents. And I can assure you, I have commanded women in my battalion in combat. I was pleasantly surprised when the ladies were more resilient than the men, because we used to walk on average 30 to 35 kilometers every day. And you'd find the men have blown, and these young ladies are still vigilant and vigorous. So I discovered it's about leadership, it's about training, it's about exposure, and you get the best out of the female gender.
Are you saying this because you are before the camera, or this is the reality on the ground? Because we all know that certainly women cannot be as men. I mean, this is the mindset that the public is having, and certainly you may agree they are not as strong as men. Are you just saying this because it's a camera, it's a TV, or it's the practice?
I'm not looking for votes. Because if I was looking for votes, then I would speak the sweet things only. Excuse me. I had 6 girls in my unit. And like I told you, would do mobile operations. And I deliberately refused to get these girls to the kitchen. Deliberately. I put them in the combat companies based on our ethos, so that I see their capabilities. And I was very pleased that they didn't disappoint me. The difference, however, of course, it's the men. The men look at every lady as a subject of the bedroom, and therefore men were hitting on them, admittedly. Anti-natural.
Yes.
Anybody who expects a lady not to be hit on by men is simply daydreaming. Men would hit on them. Remember, there were fewer than the rest of us. Out of 736, there were only 6 women. But they didn't disappoint us. And along the way, they are in tank driving, they are in the artillery, they are in the Marines, they are in the Air Force, they have been pilots. They have performed to our expectations. However, one thing I would like to point out is that when you soften, then there are those who want to exploit the chance. They want to bring out the womanliness in them. All right?
Hope. The good thing, hope is next to you.
Every human being wants a comfort zone.
Yes.
So when you are training, because fortunately I trained in my battalion, when you are training, you have to be cautious of that.
Yes.
2, it's a fact, physical strength is different, but mental strength is not. Mental strength is the attitude, is the mindset. And once you build the right mindset, then you can be sure these ladies will perform. 2, the mindset of their male counterparts, that this is a comrade, because even a man can fail to carry something, and he will seek the support of a fellow combatant. So, I'm glad that for us in UPDF, we have had deliberate effort to promote the gender equity.
I'll come back to you, General. Let me just bring in Hope, because you're raising a very important question. Hope, at what level should women and space participate in this conversation within our forces, and what exactly is the situation on the ground?
Thank you, moderator. When you ask at what level should female combatants participate, or even because it's not only female combatants, we are a ministry, we are UPDF, so at what level should the females participate? I think the answer would be at all levels. There is no level that should be restricted to men and the other to women. So the participation should be at all levels, from right to the bottom, through the ranks to the highest.
By the time partners, for example, what the commissioners have been talking about, there was a problem. And that problem was these inequalities in our forces, in our institutions of government. And I just wanted you actually to react on what Brigadier Felix was talking about, whether the women are treated the same in the forces as other people, as the men.
I think the treatment, the given parameters, the given standards, the standards are not bent, but it's a matter of raising up to the standard. So if you're a female and you're in this institution, it's you need to step up to that standard, so that the standard doesn't cut you off and you're able to rise. Whether the restrictions or not, those shouldn't be the issue. The issue is that there's a standard, and if you're to raise, then you have to raise up to the standard also.
I want now to bring in Captain Solomon, and about the issues to do with the conversation that we talked about with the commissioner. Has a lot that is involved. Gender equality, you have HIV/AIDS, you have fistula, you have all those challenges within the forces. How is the UPDF, for example, the veterans, the men and women in uniform, how are they responding to this program, specifically the HIV, because it's really becoming a problem in our country?
Thank you so much, moderator. The UPDF is organized in a way that we have already set systems to handle such cases when they emerge. I will first reflect on the issue of HIV and AIDS. The directorate set up a fully directorate of HIV/AIDS to handle issues that concerning HIV and AIDS.
Yes.
And the directorate of HIV/AIDS has got 10 program officers, of which among the 10 program officers, we have the GBV officer. When it comes to gender-based violence, we also have focal persons who are directly concerned to deal with that. And we do it in line with the Ministry of Gender and also guidance from the Ministry of Health. And the gender is also a very important issue for us as the UPDF to handle, and we have got policies that we adhere to when we are implementing our activities vis-a-vis to the same.
I'll come back to you, but I want now to bring in Mr. Samuel Mweru. When many people are talking about the UPDF, they usually refer to the men and women in uniform, but they are veterans. They are people who served this country in our forces. How are they involved in this whole conversation? Because certainly these challenges mostly affect the veterans as compared to the people who are still serving.
Yes, I thank you. Mine is the veterans constituency, and any analysis of what goes on in the veterans is important that we begin with the socio-economic characteristics. The viewers out there should be able to understand that the veterans we are talking about come from our own society. It's from there that they come and they join the UPDF, and from the UPDF that they exit and come to civilian life. So once we are managing veterans in a civilian dispensation mode. So, as I said, these are people who have come from the community and are going back at the community. First of all, the creation of the directorate, that promulgation, that pronouncement by His Excellency the President, was the realization that the veterans community should be taken care of because there are issues. That's one, because since the history of Uganda, since Uganda began, we have never had any department in charge of veterans affairs apart from 2016 when we got the Ministry of Defense renamed Defense and Veteran Affairs. Of course, we had the Veterans Board. It was there before. But I'm talking about the deepening of veteran and application of the veterans matters. So when these veterans go out there, of course, they go to their various communities. And when they go to their veteran communities, many of them work with their cultural beliefs. A number of them, as a result of their exposure in the UPDF, come out when they have a mindset that is favorable for the female gender. Because we are talking about a society where the male viewing me now are so selfish, and the bulk of you are really animals, so to say. Animals because you rape women. Any man you see close to you is a potential rapist. So a number of these things that we are talking about, we have to begin from reality. And I said, not everybody, but in general terms. So once we are doing a diagnosis, we have to look at those basics and then know what to do. So in the veterans community in the districts are organized in circles. The veteran circles, because it's difficult to oversee veterans when everybody is scattered in their various homes. But of course, not every veteran must belong to a circle, because the right of association is constitutional. So in there, we did a gender assessment as a directorate. Country, we did a gender assessment. We came to interact with men and women, and for the purpose of our viewer, when we talk about a veteran, we are talking about the ex-soldier plus his or her dependents. So we are talking about the ex-soldier, we are talking about his wife or wives, and we are talking about the children. And the children are both male and female. These issues are cutting across them. So when we got there, we have gone out, we have trained them in the circles, training them to understand gender mainstreaming, training them to understand gender equality, gender equity, to understand that this social baptism, you know, when we are talking about gender, male or whatever, we are talking about society has baptized certain things men should do according to that particular society. My colleagues have pointed out something as I still talk about the veterans matters. Men and women are weak and whatever. It is also not true. Men out there who are viewing me were being beaten by wives, meaning the women actually have energy in them. But because you just assume you're a man, therefore you think we are stronger than men. It's not every other time that women are weaker than us. It's not very true. Of course, talking about the body, that's a different matter. But to us as a veterans community, it's very important that we have harmony in the homestead.
Yes.
And therefore, we must have those issues well ingrained, deepen in them, so that the man there appreciates the role that his wife can do. The man appreciates what his daughter should be. You know, you have pension you are getting, and you should not be able to discriminate. That, okay, I may be paying for gas, I'm not living with vice versa.
Mr. Samuel, I'll come back to you, because some of these issues are the issues that we have been reading in the media. They have been actually published. But I just want to bring in now the commissioner, because some of these issues, although Mr. Samuel is raising them, but this is what the feedback that can, as well, the same feedback that would come back from, that will come from the public. I just want actually to get your view and your position as the ministry. How is your ministry responsive in its alignment? How is it aligning itself to make sure that these challenges are addressed for once and for all?
I want to say again that from a policy perspective, actually there is an ongoing exercise that is trying to review the policy so that issues that have come up as raised by my brother there are fully incorporated there. But beyond that, as he says, practically there are many things that we are doing. First of all, from a training perspective, in the curricula of the UPDF at all levels, gender is an issue that is taught, that is discussed. and not only at the training institutions, but it follows that all the way to the world of work, where they have barazas every other day, every other morning, on the issues that are happening in the community where the UPDF is. But to extend that discussion further, and I want to make particular reference to the community of military veterans. There's a lot that has been done again in partnership with the UNFPA, training and sensitization on GBV, on sexual health and reproductive health rights, issues about violence against children, issues about HIV/AIDS in partnership with my brother here, the Directorate of HIV. We've also gone ahead to do, as he mentioned, what we call economic empowerment through the formation and the support being channeled through circles of the military veterans. And in there we have, for example, a program that targets peer-to-peer training. We do a TOT, and then in every circle there are peers who provide support on all those aspects. We also have what we call a home-based program. And as you know, the military community, the military veteran community is a transit community. From uniform, after so many years when you are taken out of society, maybe at the age of 18 or 25, you serve for 20 plus years or 30 years, then you get back into the community. Now, you will find that in most cases, our brothers and sisters in uniform are never in one place. Today is here, tomorrow is in Karamoja, the other day in Somalia or in DRC. So the culture of our people in uniform is a little bit different, especially when it comes now to reuniting with their families and the community at large, to the extent that he's used a certain routine while in service. But tomorrow is out of uniform, is now getting in touch or more interactive with the family. That has also its own routine. And in between there, you may find issues coming up of gender-based violence in nature. So we follow up to ensure that we provide the psychosocial support at a point of exit to say, yes, you've been in uniform in so many places, maybe in a year you get a month to interact with your family, but now you are going to be permanently with your family. Certain issues are going to arise. So how do you deal with those?
How do we deal with that? And
Yes.
of course, from that same point, Mr. Commissioner, thank you so much for that response. But all these issues we are talking about are mostly being seen in the area, in the constituents of the veterans, as Mr. Samuel has been saying. And whereas we are talking about vulnerable groups in our countries, I think also veterans are vulnerable. But also within that constituency, there is also a vulnerable group within the vulnerable veterans group, that's the women. And I just want to actually hope to react on how the UPDF is supporting women veterans and the children in regard to HIV/AIDS, gender equality, at the same time in fighting gender-based violence. But before you actually get the response, let's first take a very short commercial break. When we return, we'll start with hope. And we are discussing gender-based violence, sexual reproductive health rights, and HIV/AIDS in the Uganda People's Defense Forces, or call it the Ministry of Defense and Veteran Affairs.